Welcome everybody to this webinar, Global Neurosurgery Updates. We're going to talk about the power of young neurosurgeons. We have three speakers today. We are going to start off with Dr. Oya, Professor Oya from Vaughan University Graduate School of Medicine. And after him is going to talk Dr. Vaughan, Associate Professor of Neurosurgery at Barrow Institute. And after her is going to be Dr. Ignatius Esene, who is also a neurosurgeon and very big on equity in research, neurosurgery research, and he's going to talk about that as well. So let's start off with Professor Oya.
Oh, Elian, we just want to say welcome remarks. Me
Sorry.
and Professor Kato, is that okay? Yeah.
Okay,
yeah.
yes, sure.
Okay,
we're going to start with Professor Kato or Dr.
Yes.
Okay.
I'll take a welcome overview. I think this is the first time to the webinar. I think it should be long lasting in future. But three topics are very variety. I think it's very, very interesting for all of us. Thank you very much.
Yeah. Thank you, Professor Kato. So I had the pleasure of, can someone mute? There's a lot of background. Thank you. Yeah, hi, everybody. Key Park. I'm the director for Global Neurosurgery, co-director at MGB Neurosurgery, and also the Policy and Advocacy Director at the program in Global Surgery at Harvard Medical School. I had the pleasure of visiting my mentor, Yoko Kato, in Nagoya early this summer in our department. And one of the things that came out of that visit was, hey, can we do a joint webinar with ACNS and then Harvard MGB Global Neurosurgery? We're joined by also Kerry, Vaughan. As Professor Kato has said, we are hoping that this will be the beginning of many other collaborative webinars. I love the topic, which is the power of young neurosurgeons. Global neurosurgery, as we all know, has to do with building capacity in those places where they have very little access to neurosurgical care. And it's really the young people who will take place in these places, who will be the ones operating, people like Ignatius and Eliane and Kerry. So I think the topic is perfect, and you're in for a treat with some fantastic speakers. So back to you, Eliane. I'm done with my remarks.
Thank you. So we also have Dr. Tari Khan, who is also the moderator during this webinar, but I understood that he is going to keep it short as he has other things he needs to do. So yes, let's start with the first speaker, and that is Professor Oya.
All right. Thank you for your introduction. I believe you can see my slides. Well, it's a great honor for me to have this opportunity to give a talk today. My name is Soichi Oya from Vaughan University. The title of my presentation is The Path from a Small Door to the World Neurosurgery. Well, you may think that the center of Japan is Tokyo, but actually, as you can see here, the true center of Japan is Gunma. Well, I'm joking, but actually Gunma is a wonderful place full of nature and attractions. We have relaxing hot springs, beautiful parks filled with seasonal flowers, historic bridges with stunning autumn colors, and cool mountain highlands in summer. I prepared two topics for today. My first topic is going to be our activity, introduction of our activity of Japan Simultaneous Interpreter Group in Neurosurgery. Now, approximately 70 members belong to our group.
What we have found out during the discussions.
This is what we do.
Well, Professor Fukushima, you didn't talk too much. And, could you please give us some comments regarding the 21st brain surgery? As you know, I have
I believe you
I
know him.
started the career of
He is
neurosurgery
late
32
Professor
years
Fukushima.
ago. And
Well, this is slightly older video, but it gives us good introduction of our activities. We provide simultaneous interpretation for Japanese speakers and modulators so that international neurosurgeons and researchers can actively join the discussions. Of course, we are not professional interpreters, and our English skills have their limits. However, as neurosurgeons, we have the ability to instantly understand what the speakers wants to convey just by looking at the sentence.
After the 5 years, the motor function.
So by making full use of that skill, we can help bridge communication between Japanese and international participants. Every summer, we run a 2-day boot camp to sharpen simultaneous interpretation and English presentation skills. Participants give talks in English and offer each other constructive feedbacks on slides, wording, and delivery. We also provide one-on-one training for Japanese to English simultaneous interpretation in our trainer-trainee format. Well, in addition, many Japanese neurosurgical subspecialty societies offer observership and surgical training opportunities, mainly for young neurosurgeons from overseas. For example, in my field, skull-based surgery and cerebrovascular surgery, the Japan Skull-Based Surgery Society, for example, organizes observership programs at skull-based centers across Japan. The other example is J-Mover, the Japan Microvascular Anastomosis Training Course. Through this program, Japanese Neurosurgical Society continues to engage in steady and meaningful international surgical education activities. So my second topic is how to connect yourself to the world neurosurgery. I believe most of the audience today are young neurosurgeons who wish to connect with the international neurosurgical community. There are, of course, many types of clinical researches. Multi-center randomized controlled trials produce high-level evidence, but I will not be talking about those today. Instead, I like to introduce a few case reports that I was personally involved in to show that even residents who work hard every day at the bedside can conduct small but meaningful research. The late Dr. Kazuo Tsutsumi was one of my mentors. I was very fortunate to be able to receive education from him. He was a master surgeon, but also valued scientific thinking, publishing original articles in journals such as Stroke and JNS from a small countryside hospital. Dr. Tsutsumi always encouraged us young neurosurgeons to write case reports, so I often wrote small case reports like this. Looking back now, those cases were not quite good and had little clinical impact. At the time, I didn't really understand neurosurgery well enough to know what was interesting and what was not, what wasn't. So I just wrote case reports whenever Dr. Tsutsumi told me to. I tried to imitate what he did and submitted them to journals like Stroke, Journal of Neurosurgery, and Neurosurgery, and so on. And of course, as you might expect, the results were disastrous. And I received a barrage of rejection letters. Eventually, those case reports were pushed further and further down to the submission ladder. and finally ended up being published in a small Japanese neurosurgical journal. That experience, was quite painful, even for insensitive persons like me. But one day, I was in charge of another emergency case, a patient with PITNET who had a pituitary apoplexy. And the patient developed lethargy caused by severe hyponatremia. The serum sodium level was 106 mg per liter. I started careful correction of the sodium level. However, during my night duty, the ICU nurse called me saying the patient had suddenly became unconscious. When I examined the patient, he was in deep coma, the mouth half open with saliva drooling, and the deep tendon reflex were hyperactive, indicating spastic paralysis. The serum sodium had unexpectedly risen to 132 mg per liter in just 48 hours. Even a young and inexperienced doctor like me at the time immediately realized what was happening. This is very bad. This is the beginning of the central pontine myelinolysis. At the time, our hospital, a small rural facility, had only one computer connected to the internet. So I searched PubMed and found a paper describing rat experiments showing improvement after rapid re-lowering of sodium. So I thought, this is it. And I administered desmopressin and distilled water intravenously to lower the sodium quickly. Amazingly, the patient made a dramatic recovery within 2 days. Of course, now I know better than that, but I did it this time. And we wrote a case report and submitted it to Neurology, a very famous journal. And this time the response was completely different from the cold rejections we had received before. One day, the editorial office of Neurology sent a fax to our small rural hospital saying, please correct the English in this section, add these data, and let us know when it's ready. I was so happy to realize that if a case report is truly interesting, even a top-level international journal will reach out to you. That report was later cited in a well-known textbook of nephrology. And if your boss tells you to write a case report, just do it. By doing so, you naturally learn how to write one. The first case report is always the hardest and takes the most time. But the more you write, the easier it becomes because it's about your patient. So you'll find it genuinely interesting. And it's also part of your responsibility towards that patient. And remember, even a small case report can be an entrance to the world neurosurgery. In relation to my responsibility towards patient, I'd like to share another experience. A young woman came to our hospital with a 6-month history of loss of appetite. She had undergone repeated gastroscopy or colonoscopy, but no abnormalities were found. Her condition gradually worsened and she had to quit her job, and eventually she began sleeping almost all day. Well, her worried parents took her to our psychiatric clinic where she was diagnosed with anorexia nervosa and started on medication. However, one morning, she suddenly collapsed at home. She was brought to our hospital in cardiopulmonary arrest. We managed to resuscitate her, and this was her head CT scan. Any neurosurgeon would immediately recognize what had happened. It was a hydrocephalus caused by a cystic tumor in the posterior fossa. We rushed her to the operating room and performed an emergency craniotomy and a tumor resection. During surgery, we found that it was a very, very small, tiny hemangioblastoma. despite all our efforts, she did not survive. If only she had been diagnosed earlier, she would most likely have lived. Why were her symptoms overlooked? There was another similar case at my hospital, and when I reviewed the literature, I found 7 reported cases of posterior fossa tumors that presented with emaciation and are initially diagnosed as anorexia nervosa. So among them, 4 were hemangioblastomas, which I thought was disproportionately high. So I came up with this hypothesis. Cystic hemangioblastomas tend to grow near the brainstem, but they rarely cause obvious focal neurological deficits. However, we may be able to interpret this as possibly involving focal deficits in the nucleus tractus solitarius, which is the center of the appetite regulation. So I wrote a case report, and this was also published in Neurology. And the case reports, as I show you, I can sometimes connect you with giants in the international field. This case involved a 44-year-old woman who presented with depression and a flat affect for about 1 month, along with decreased energy. Routine medical examinations ruled out common physical causes such as hypothyroidism. However, her MRI screening revealed a small contrast-enhanced lesion in the cerebral column. In addition, SPECT imaging showed reduced blood flow in the left frontal lobe. Psychological assessment using several depression and anxiety scales indicated a state of moderate depression and anxiety. The CSF protein level was slightly elevated, and we initially suspected some kind of demyelinating disorder. So we, together with our neurologist, we tried steroid pulse therapy as a diagnostic treatment, but this was no improvement. There was no improvement. With the patient consent, we decided to remove the cerebellar tumor. The pathological diagnosis turned out to be a hemangioblastoma. Her postoperative course was truly remarkable. Within just 1 week, her depression and flat affect completely disappeared, and the depression and anxiety scores returned to normal. The edema around the lesion resolved, and blood flow in the left frontal lobe improved significantly. While traditionally the cerebellum has been considered responsible mainly for motor control, however, recent research has shown that it also plays important roles in cognition and emotion, leading to the recognition of a new condition known as cerebral cognitive affective syndrome. Well, this case report was also accepted by Neurology. Through this case, we were able to show that even ordinary neurosurgeons can make small but meaningful contributions to neuroscience. It is our great honor that Dr. Schwarman, a world leader in this area, wrote an editorial to accompany our paper. The next step is to apply what you've learned from writing case reports and move on to writing original research articles. Of course, the path to becoming a skilled neurosurgeon is a rocky one, but even for busy neurosurgeons who devote themselves every day to improving their surgical skills, it's still possible to carry out small but meaningful studies. To do so, you need to develop a mindset that constantly asks questions and seeks answers in daily clinical practice. It's simple. Such a mindset will connect you to the world of neurosurgery. Today, I introduced our international activities, including initiative like simultaneous interpreter groups. and some observership programs of Japan Neurosurgical Society. And I also spoke about the importance of writing case reports, or at least having the mindset to write them as a first step towards strengthening international connections in your surgery. Thank you very much for your attention.
Thank you so much for that interesting talk and describing the powers of case reports. Are there any questions? If people have any questions, please put them in the Q&A so we can answer them. But if there are no questions for now, then we will continue with the second speaker, and that is Dr. Vaughan, who I already introduced. And she will be giving us a talk. So please, Dr. Vaughan, go ahead.
Thank you, Dr. Rubios dos Santos. Thank you to the ACNS for hosting me as well. It's a great pleasure to be able to join you this morning from Phoenix. Let me share my slides. And let's give it a second. So I wanted to kind of expand on what Dr. Oya started talking about a little bit into entering the world of neurosurgery, and specifically from a global standpoint, what it means to, what this community really means and what it means to join it, and how, you, especially as a young neurosurgeon, can start to get involved. This is an incredible place to be able to join, meet different people, learn a lot. As Dr. Oya mentioned, there is an incredible amount of knowledge to be learned and shared in neurosurgery, and we don't have all the answers. And one of the ways to do that is to be able to share ideas and talk through ideas around the world to get different projects started. So I wanted to first give you a very, very brief overview of kind of what the context of global neurosurgery is, what it's starting to look like now, all its different components, and where you fit in as the future of the community and of global neurosurgery and global health. So the kind of formal definition that's evolved over time is that global neurosurgery is the clinical and public health practice of neurosurgery aimed at ensuring timely, safe, and affordable neurosurgical care for all who need it, particularly in underserved regions. This encompasses a lot of different ideas and comes from a few years of work of people bringing together, again, different efforts in connecting momentum in neurosurgical care around the world, and understanding that there are a lot of inequities in the field in what we do. And this is one way to try to break down those silos, break down those barriers, not just within neurosurgery, but in global health overall, with many great thinkers and doers and neurosurgeons like Dr. Key Park as movers and shakers of the field, who've been working on these efforts for a decade plus at this point in, again, just creating links. That is really the first step in creating a global understanding of what are we doing, how can we avoid duplicating efforts, and how can we work together to improve care for all of our patients around the world. No matter kind of the existing inequities, how can we work towards reducing those globally, which is, I think, especially important with kind of ongoing political changes at a global scale, and what role we can play as individuals, as neurosurgeons especially, and as a community. And as I hinted at, this is really an all-encompassing idea. It's centered around patients, which you can kind of see in the middle of this diagram, but it doesn't just pertain to clinical care. So it's not, one case of, okay, taking care of a patient, helping to do surgeries in one place. It goes so far beyond that to include efforts related to it, research and education that help with sharing what we learn, and inspiring others to create and lead change in their own settings and hopefully helping them towards that, but also really expanding into other domains like technology and innovation, and how can that improve care in patients? How can we become the innovators as frontline workers and advocate for our patients because we understand what it is that they need in different settings and learn from each other. What do you need in your neurosurgical practice that's different than what do I need in my neurosurgical practice? That voice, that joining of voices is incredibly important and kind of comes at the center of all of these efforts. And then another big part of it that kind of looms in the background and finds its way into our daily care, I think for many of us, is also the economics of practicing medicine, especially neurosurgery. And that includes both the financing of care at a micro level for each patient and globally with financing systems for building stronger health provision mechanisms, but also understanding, what is affordable and possible in different areas. So these are really all different domains, and I kind of run through these because these become ways that you can participate in, sharing of knowledge within global neurosurgery on each different stage. So there really is an area potentially of interest for everyone who wants to kind of build on this community. And again, this has come from a broader context of global surgery and obstetric trauma and anesthesia care that was initially launched by the Lancet Commission on Global Surgery, which the Harvard PGSSC played a critical role in leading. That came up with estimates that 5 billion people lack access to safe, timely, and affordable surgical care around the world. And I think many of us have heard these numbers, but within the past 10 years, I think we've started to move the needle on these numbers just by having conversations as an initial breakpoint, and then leading to different efforts and projects on all different scales, from very local scales, regional, national, continental, and then global. And neurosurgery comes in at a huge, kind of a huge component of these, but it's not obvious at first glance. If you look at these in terms of the highest causes of mortality worldwide for projected deaths, through 2030, we're relevant to the majority of these cases. If you look at especially the upward trending lines for cancer, cerebrovascular disease, and then lower down road traffic accidents, those are obviously a large part of most of our clinical practices within neurosurgery. There's also perinatal conditions that is incredibly important for many of us who practice in global settings or work with people in various settings around the world where there isn't as much subspecialization into pediatrics. But it allows us to enter into a lot of different efforts from, again, all the way from clinical care to looking at the financing behind cancer care to advocating for nutritional supplementation on a global scale with folate to try to reduce the burden of spina bifida and neural tube defects and having that passed as a WHO resolution. All of these have been very strongly neurosurgery-led efforts, so we can go beyond even our community as we learn from each other to really engage with the global surgery and global health communities and the world at large, like the United Nations and World Bank. So this is really meant to kind of inspire you and say, how can I fit into this? Even if you're just practicing in one area, that is still incredible work and very important to reduce this global neurosurgical burden. Again, work coming out of Dr. Key Park's group and the PGSSC from 2018 was estimating specifically the neurosurgical burden, now narrowing down from the global surgery estimates to neurosurgery, where the calculations showed about 13 million additional procedures needed worldwide, with most of those, as expected, but unfortunately falling in low and middle income countries. And where, again, one of the areas that we would like to revisit and show, have we moved the needle? Are we getting better at encouraging and creating access to neurosurgical care, in our case, for those who need it the most? And this is in part related to a workforce deficit where if we're looking to create kind of an ideal neurosurgical workforce density around the world, we'd need approximately 22,000 more fully trained neurosurgeons in the workforce. And obviously, that's where sharing knowledge and education and training the next generation, including many of you, becomes a critical piece of what all of us can do at any age. This is, focused especially on the generation of emerging leaders in global neurosurgery and inspiring you to become a part of the community if you're not already. But really applies to all of us. We all have a role to help our patients. And one of the ways to do that is, again, training kind of the next generation and understanding how can we fill that workforce gap. So this matters because it's, again, all in service of the patients. I think most of us still have kind of the patient and the people at the center of a lot of our momentum for doing this, but it creates a platform to be able to break down those silos of people practicing in very narrow contexts, if you will, whether that is in their own domestic setting or going abroad for kind of the historical mission trips. This is meant to go beyond that and say, what can we learn from every single step of the process, whether that is, again, in clinical care, financing, technology. How can we partner with different types of groups that we historically didn't think we had a lot of overlap with, whether that is, social impact investment firms, whether that is venture capitalists looking to create new types of technology to make access to care easier in neurosurgery. So this kind of platform to share ideas is really the foundation of kind of global neurosurgery, again, to work on building stronger healthcare systems for our patients as the ultimate goal. And a lot of that energy comes from young neurosurgeons and trainees and medical students who are really the heart and soul of what we do, with efforts from on the ground, taking time out of their training to be able to go to a different setting and be humbled and learn. You'll see, an example from our partner site in Tanzania with one of our residents, Dr. Sayer Salahi, learning from two of our Tanzanian residents, Dr. Sengua and Dr. Dillon, how to operate a jiggly saw and how to adapt to the workflow at KCMC. And this interchange of ideas, this picture really captures that beauty of sharing a connection and sharing ideas. Here, obviously, it happens in person, but especially after COVID, that also has become much easier to do online through mechanisms like these, through webinars, through working group meetings, through numerous research collaborations. So that can culminate in kind of major efforts like the Boston Declaration, which happened earlier this year, led by the Mass General Brigham Neurosurgery Group, again, with Dr. Keepark as one of the movers and shakers, really trying to bring everybody together who has an interest in this area, no matter how small or how big, how new to the field or not. There was a core group of students who led the creation of this incredible conference and momentous launch of declarations, meaning there were a number of organizations, academic institutions, technology groups, NGOs, governments who made pledges to the global neurosurgery community within our community and saying, this is what we plan to work on over the next few years. This is what we're building. And examples could be everything from online curriculum to a series of library and resources available for neurosurgery knowledge around the world that's easily accessible, to building training programs, to building stronger capacity in countries. So it gives you a sense of how critical that energy from the emerging leaders is in shaping the future of neurosurgical care and global neurosurgery and global health beyond. And this is going to become something that we'll revisit regularly to track how are we doing as a community? Are we making progress in reducing inequity in care around the world? Are we holding up to our pledges and our declaration to improve care for patients worldwide? And we would love to have you join in any way, shape, or form, whatever your interest may be. So that brings me to the next step of what are the concrete things that one can do to get involved and, again, improve care for patients worldwide. A lot of what we do comes from, groundwork laid by giants in the field. One of my earliest mentors is Dr. Key Park, so I have him to thank, among a few others, for really allowing me to enter this field and developing it, as an academic career. It is the goals, and that would not be possible without people who have spent, many, many years in showing the value of this work and the importance of this work, going beyond borders to take care of patients in global settings. So that brings me to, again, back to our diagram of all the different components of global neurosurgery and how can you get involved? And the answer is really at any stage and in any form that interests you. There's always space to have more people join the community, whatever time, whatever the age of the person, again, aimed especially at young neurosurgeons, but for anybody interested. There's opportunities, I would say, throughout, let me see if I can move these, opportunities throughout the spectrum of exploration in global neurosurgery, from education, whether that is learning from those who've had different experiences to you, to passing along that knowledge to trainees, students, getting people interested and aware. Research obviously is, a common part of neurosurgical education, but can be difficult to access depending on the setting that people are in. And there are so many different types of research that is starting to evolve out of this community beyond the standard clinical research. So there's a lot of opportunities there. Technology. I've seen young doctors become interested, for example, in developing individualized care in settings where access to specialized clinics is limited, and minimizing the number of referrals needed to get to a neurosurgeon, for example. So public health awareness and education based on, again, leveraging technology to facilitate that. Same with policy. You have an incredibly important voice as part of the neuroscience world in helping to shape what policy can develop in terms of health policy or financing policy. I've seen people with a strong interest in AI as related to healthcare and getting involved in that level of policy. So whatever your interest may be, you can develop a strong voice, and that becomes a part of advocacy, of using your knowledge, your experience to advocate for our patients, for our healthcare systems, for whatever needs you think are or important or relevant at that time. And obviously, it does take time to start to kind of build that momentum for a lot of these different components. But that is the beauty of joining and kind of getting started early as a young neurosurgeon, is you have many, many years to learn about different realms than you've typically been exposed to, beyond just clinical neurosurgery, and opportunities to learn from those around you, older and younger, who've been in the field or who've had different paths to getting to it. There's always something to learn from everybody that you meet and encounter. And that, I would say, is another, very individualized bonus for many people, is the relationships that you form out of this and the connections. and hearing different people's stories, it really allows you to grow as a person beyond, again, kind of just the book knowledge of neurosurgery that we all gain through our years as students and trainees. So one example of this, kind of becoming formalized and building momentum, I'll show you our Barrow program in Tanzania. I mentioned earlier that we are partnered with the neurosurgery team at KCMC, and we were able to formally introduce a neurosurgery training program there with our first two residents, Dr. Tumani Mchahio from Tanzania and Dr. Dylan Omwenga from Kenya, joining our program at KCMC this year. So they're in their first year of formal neurosurgical training, and it's a joint program between KCMC and Barrow. So we're excited to be developing, new formal educational opportunities in neurosurgery, and that is very much a collaborative effort with our two local teams and involving a much broader cadre of neurosurgeons, neuroanesthesiologists, neurocritical care folks to become a part of their education, and many, many other fields beyond neurorehab, neuronursing. I could go on and mention a number, but this is kind of one very concrete example of, ways to get involved. And a lot of the young trainees locally have become more interested in neurosurgery and in global neurosurgery through kind of the development of this program and hearing about it. So that generates a lot of interest. And that development of interest is a very first step for many to become interested in all the other domains I kind of talked about earlier. So we've surveyed medical students and their impact on global neurosurgery, as well as how they developed interest in global neurosurgery and whether they were even aware of it, and showing the importance of mentors and exposure. So again, no matter at what stage you're at within your neurosurgical career, there's always an opportunity for you to engage with the next generation, which goes by much more quickly, I think, than we expect to. But engaging with the next generation to gather their interest and help them learn about the world of neurosurgery. If it's a fit for them and they're interested in pursuing it, great. Encouraging that interest and finding what their niche is, what their strengths are, what they need to learn beyond, again, obviously a strong clinical foundation of neurosurgery. So this brings me to really the crux of this talk, which is you matter. I've given you the introduction to global neurosurgery, but none of this would happen without many, many, many very devoted and energetic and smart people, much smarter than me, who have, again, laid the groundwork in the field over the past decade or two, and are continuing to lead it into the future, again, to improve healthcare and kind of reduce those inequities that I talked about earlier for our patients. No matter what age you are, there's always something to share and lessons to be learned. And that's where the power of the next generation is critical in continuing and evolving and expanding on the work that is going on now. Part of the fun is seeing in which direction the field goes, because it might not turn out to be, for a certain project or a whole field as we expect it to, but as long as, it's improving care for patients, there is some organic evolution of global neurosurgery, which is really exciting to see and to be a part of, especially for trainees. They find that that's one of the most rewarding parts of being at conferences or webinars or talking to frontline workers, is seeing how it evolves and giving them ideas for projects and improving care for their community. So on that, thank you for your time and for listening. I hope that this has inspired you to see a little bit of the variety within global neurosurgery, and hopefully join in whatever way, small or big, that you may be interested in. Please feel free to reach out at any point, I think, to any of us on the panel on how to join. We collaborate across the panel, and I'm sure would love to have you join in any efforts. So thank you all, and I will pass it back to Dr. Dos Rubio Santo.
Thank you, Dr. Vaughan, for that beautiful elaborate talk. I think it clarified what global neurosurgery is for people that didn't know. And I think it's a good follow-up talk to what Professor Oya said, and his point of view of, being in rural setting hospitals with not many facilities and trying to get, his personal experience out there, getting it published, being made, difficult to get it published. And that is one of the problems within global neurosurgery, that there's inequity in many, many layers. So it is extremely important for people, especially in lower resource settings, to get the information out there, because that is a huge part of global neurosurgery. So I don't know if there are any comments, additional comments? No? So then we will continue with the last talk, which is Dr. Esene, a neurosurgeon from Cameroon. And he's going to talk to us about the challenges and opportunities in achieving this equity in research for young neurosurgeons. Go ahead.
Thank you so much, Ilian. Good afternoon to everyone. So this afternoon, we're talking about the challenges and opportunities in achieving equity in global neurosurgery research for young neurosurgeons. I want to sincerely thank the organizers of this meeting, the Asian Congress of Neurological Surgeons, and the program in global surgery and social changes in Harvard, and all the speakers. I think Professor Oya, we met in Cairo during the Egyptian Congress of Neurosurgery. I've met almost everybody in this flyer except for Kerry, even though we worked together for 4 years in the WFNS Young Neurosurgeons Forum. So global neurosurgery has evolved over the years from the mere traditional clinical practice of neurosurgery to the clinical and the public health practice of neurosurgery, as the previous speakers have outlined, with the goal of providing safe, affordable, and timely care to people in need. My journey as a global neurosurgeon began around 2009, when I finished my training in public health in Brussels and started my training in neurosurgery. We heard Professor Oya talking about the case report. When I started my residency, I was so curious because, most of the times we were in a hospital, so I saw a lot of cases. We were receiving hundreds of cases per week. And most of the cases we tried to write and publish, but they were rejected. So I started looking at what are actually case reports. Is it that we are not writing them appropriately, or there's a way for them to be written? So with my background in clinical epidemiology and statistics, I surveyed all the case reports that have been published in neurosurgery and tried to look at what is the actual definition of a case report. So I actually sent this paper, which was published by Professor Apozo, and before then, I had contacted Professor Kato to have her opinion. I didn't know her, I've never met her physically, but I just knew that she was somebody that was very supportive of young neurosurgeons. And so this is the email she wrote to me. She was supportive of the idea of evaluating the quality of research in neurosurgery and actually coming out with clear definitions, because this is very important, especially in the era of evidence-based medicine, where primary studies are combined into meta-analysis and systematic reviews. So if you combine primary studies which are not appropriate into systematic reviews and meta-analysis, their conclusion might not be correct. Over the years, Professor Kato has been very supportive, so she invited me to join the editorial board of the Asian Journal of Neurosurgery. So I'm so grateful to her, and I'm so happy to have her on board today. As I said before, I've met many of the speakers on this panel. Yes, Professor Tariq, we're together in Cape Town during the global neurosurgery session. I wouldn't have been a very good, maybe interested in global neurosurgery if not of Professor Dempsey, who is one of the pillars of global neurosurgery. Of course, Elian is one of my very good friends. We met together in Cape Town and we've organized some webinars together. Of course, I became so passionate about global neurosurgery when I got connected to Professor Kipak. And we've been thinking about a lot of things, because one of the projects which is very successful, which I think is our most successful project, is a project of the Journal of Global Neurosurgery, because as you can see on this slide, which he was presenting the journal in Bogota, there has been so much difficulty for young neurosurgeons to publish their work. Subscription-based journals make it difficult for people to have access to published work, and open access journals make it difficult for neurosurgeons to publish and pay before publishing. So therefore, it was very difficult. So we created this model of a journal where people won't pay to publish and they won't pay to have access to articles. So together with Andreas Rubiano, we came up with the Journal of Global Neurosurgery. And since then, I've been working with Professor Kipak, and he has, of course, mentored generations of young neurosurgeons, and I'm proud to be one of them. So why is research important in neurosurgery? You know, the practice of neurosurgery today is guided by one paradigm shift, which is the paradigm shift of evidence-based neurosurgery. Evidence-based neurosurgery is the integration of the best research evidence, surgical expertise and experience, patients' values and preferences to offer optimal care to the patient. So be it at the level of public health or at the level of the clinical practice, decisions should be based on evidence, and this evidence has to come from research. So to further investigate the issue of risk in neurosurgery, when Professor Sevade was the president of WFNS, we did a survey to understand the needs and the challenges of young neurosurgeons. So I see here, this was a survey that was led by my friend Angelos Amr Habib, and you can see Kerry. Kerry was one of the members of this team. So we did this survey and we realized that the three most important challenges for young neurosurgeons were research, education, and the need for fellowships. Over the years, I've been very much focused on research because a lot has been talked about education and fellowship. And when we analyze the results, at the level of Africa, Europe, or Asia, we realized that there was a great need for research. Most neurosurgeons in these areas, in these continents, reported that they had difficulty in conducting and publishing research. So we therefore had it as an agenda to develop research capacity building and assist young neurosurgeons in writing and publishing their research. And we recently conducted a study which is under review now. I think it's going to be published sometime very soon. And one of the results highlighted that the biggest barrier to conducting research was the lack of skilled neurosurgeons trained in research, in conducting and publishing research, and also the lack of time, especially for young neurosurgeons in low and middle income countries. So this is a team which we led, which we conducted this survey. And this is very true because in 2015, when I was doing my residency, I realized that even though we did a lot of work, little was published. We operated so many patients every day, 10 to 15 patients in our department, but there was little publication coming out of the department. This was because we were so busy that there was no time to collect the data. There was no time to analyze. There was no time to design studies and publish. And so this is a situation which you find in most LMICs, and this has to change. So, and this has led to what? Has led to disparities in research between LMICs and high-income countries. So disparities are actually real, and we already know the determinants. We know the distribution. So we need to actually act to change this. And we know from previous studies that the disparities existing in neurosurgery, especially with the focus on young neurosurgeons, start from the conduct of research, collecting data. In most LMICs, data, there are no electronic data files. Most of the work is collected on papers. They are not available statisticians and research methodologies to help in designing prospective and studies and RCTs. When these studies are conducted, to publish them in open access journals, they are paywalls which act as barriers for young neurosurgeons to publish their work. And even before publishing, you need to do a literature review to have access to subscription-based journals. It's also very difficult because most of the universities and institutions in LMICs are not subscribed to this journal. So you see, the barriers stem from the beginning. That is the inception of an idea right up to the use of research in neurosurgery. So therefore, there's a need to actually look into these problems and actually solve them. So what are actually these barriers, and what are the opportunities we can extract from these barriers to improve on the challenges faced by young neurosurgeons? We are going to look at these barriers at two levels, at the system level and at the individual level. And this is going to be based on my experience leading the Young African Neurosurgeons Forum, the WFNS Young Neurosurgeons Forum, and the Young Spins. So if we look at the health system, we know the health system has a number of building blocks which have been well described by the World WHO, from workforce, infrastructures and equipment, service delivery, information and technology, research, the financing and leadership. So young neurosurgeons face barriers. They face challenges at all these levels. Most young neurosurgeons, especially in LMICs, work as single neurosurgeons. For example, when I returned from a training, I was covering an area of about 10 million population as a single neurosurgeon. It was very difficult for me to collect data at the same time and publish. So and that's a similar situation faced by young neurosurgeons in Sub-Saharan Africa, Southeast Asia, and Latin America. The pay package is not so much. So when you compare maybe what your peers earn in high-income countries, you might be tempted to move away from your region to an area where you can have high salaries. So this leading to brain drain. Because of the high patient volume, there is limited time allocated for research. And sometimes there's neurosurgeons who are on the ground, whom I classify as the traditional neurosurgeons. They're not conversant with research, so they don't think research is even important. So there's that lack of mentorship. And if you're not fortunate to get maybe a mentor from a high income country like I had, it's difficult for you to be able to trace a path and get to the top of your career. Of course, practicing in LMIC, the lack of infrastructure, there's a scarcity of equipment, and as I said again, due to the high work volume, it becomes very difficult for any young neurosurgeons to publish. Even though technological advances are readily available for young neurosurgeons in the high-income countries, back in our settings, it's very difficult. You might not be surprised that as I'm talking, sometimes maybe the internet might get disconnected because the bandwidth might not be very strong enough to maintain a very long discussion. So therefore, young neurosurgeons in low-income countries face a lot of challenges, even a lot of technologies. And when you go to funding and leadership, we know neurosurgery is a specialty where leadership is based on seniority. So there are very few young neurosurgeons in leadership positions, and those who make the rules at the table always make rules to favor them. So most of the rules are not made in favor of young neurosurgeons. So it makes it difficult for them to navigate through this difficult path to get to the top of their career. At the beginning of the career, it's difficult to get funding. It's difficult to get a grant. You need to work for some time to get the experience to be able to get a grant. So young researchers face these financial challenges. So it makes it very difficult for them to conduct and publish research. And this widens the gap of and broadens inequities. So when I was looking at some literature so many years ago, I realized there's a paper that was published around 2010. And you realize that here, Africa contributed to just to 0.3% of the global research output. And in a recent paper by Professor Franco Savadai, all LMICs contribute to less than 5%, with Africa less than 1%. So we started looking for ways to actually change this situation. We've already talked about problems related to the research output, but there are other problems faced by neurosurgery research at the micro level, problems related to the quality of neurosurgery research. These problems are related to the quality of the way neurosurgery research is conducted and the way it is reported. You might conduct a very good research, but if it is poorly reported, just as Professor Oya said, because maybe of language issues or maybe because you didn't have a good, well-designed study with a good statistical analysis, it might be rejected. Similarly, you cannot get the paper published if it is well reported, if the methodology was not correct, if it was not well conceived. So we need a very strong research workforce to be able to get to it. So we evaluated the quality of neurosurgery research across neurosurgical journals. And we realized that, especially in LMICs, there are very few young neurosurgeons involved in bench research, and to make much advancement in neurosurgery, for example, in surgical approaches, you need to have an anatomical lab. And if you don't have enough resources, you can't build one. So therefore, you can't conduct good basic anatomical research at the early age of your career if you're not affiliated to very advanced institutions. Also, neurosurgeons in general, not just young neurosurgeons, publish very little qualitative research. Most of the research in neurosurgery is quantitative. We know evaluating something quantitatively is not enough. We need to add the qualitative part of it, how the patients feel, what is the attitude, what do they think about the outcomes, not our outcomes as surgeons, but the outcome of the patient. What are the patient's expectations? So if we don't involve or integrate qualitative research into quantitative research to have a holistic view of the way patients expect from us after surgery, then we are not going to have better outcomes and improve on the care of our patients. So we first of all try to develop an algorithm to make young neurosurgeons understand a simple approach to quantitative research designs. And from this algorithm, we realized that although most of neurosurgical research is quantitative, most of it is also observational. Neurosurgeons publish very little high-level studies like ROCTs. You see here, ROCTs in neurosurgery contribute to just 2.1%. So just 2.1% of neurosurgical research is composed of randomized clinical trials. And we know this is the gold standard for decision-making in patient care. Most of neurosurgical research is made of very low-level evidence, level 4 and 5. So surgeons and neurosurgeons are challenged to produce better level of evidence. those in high-income countries have the means, they have the resources, they have the financial power to do this, but in low-income countries, it is very challenging. Yeah, I'm well trained in research method, but I need the resources to be able to conduct a randomized clinical trial in my setting because it entails a lot of resources and finances. So when we evaluate the quality of studies published in neurosurgery, we realize that more than 50% of studies published are of very poor quality. So young neurosurgeons who intend to take over neurosurgery in the coming years have to understand these challenges, and they need to work very hard to ensure that the quality of studies published in neurosurgical journals are of very good quality. So can we actually fix these problems? Yes, we can fix them. A lot of tools have been developed in other fields, such as clinical epidemiology. Okay, we have the Equator guidelines enhancing the quality and transparency of health research. So if we use these tools, we are going to be able to conduct and publish high quality research and therefore improve on the quality of care of our patients. So just give some practical example of what we did on the field to solve these problems. So when I was the chair of the Young African Neurosurgeons Forum and co-chairing the WFNS Young Neurosurgeons Forum with Angelos, we conducted a number of research capacity building courses across Africa and across the world. You can see here this keeper who was an invited speaker for the meeting. This Professor Benzel, whom we invited. We invited many editors-in-chief to participate in our courses and build the capacity in Africa for young neurosurgeons. We didn't only involve the young neurosurgeons, we also involved medical students because, as I said before, working as a neurosurgeon in LMIC, the work volume is so high. So therefore, there's no time dedicated to research, collecting data, managing the data, and so on and so forth. If we train medical students and involve them in the process, then they will be able to assist us in for example, managing data and helping us in doing good research. We also talk to so many journals in operationalizing neurosurgical research in journal, and this has been well received. There are many journals that now have a section for evidence-based medicine. They have a section for global neurosurgery. And there's a dedicated journal, as I said before, developed by Kipak, Andreas Rubiano, and myself, which is open access with no paywalls and where young neurosurgeons can actually publish their work without any barriers. And again, as I said, we'll be advocating for open access publishing, just as in the Asian Journal of Neurosurgery, which is an open access journal. You don't need to pay to have access to the articles published there. And we hope that in the coming years, almost all neurosurgical journals are going to be open access to break away these barriers that are impeding them from having access to information. Of course, young neurosurgeons want to succeed, and they want to succeed quick. So most of them fall prey to predatory journals. They are vulnerable to predatory journals. So we caution them because even though we advocate for open access publishing, there are many predatory journals that send out emails, encouraging young neurosurgeons to send articles which they can publish very quickly within hours to days. They should be aware of such journals because it doesn't only tarnish the image as researchers and as neurosurgeons, but it can also lead to publishing work that has not been well peer-reviewed and can have false results. We encourage innovation and technology among young neurosurgeons. There's one of the young neurosurgeons, Federico from Italy. He developed the neurosimulation models, which we use and develop and conducted more than 45 courses in LMICs. So with innovation and research, we are able to mitigate the gap in disparities existing between the young neurosurgeons. So just to give a concrete examples, this is the research output in Africa from 2000 to 2024. Okay, so in 2012, there was the creation of CANS. CANS is the Continental Association of African Neurosurgical Society. And in 2018, there was the creation of the Young Neurosurgeons Forum. So when you look at the research output in 2024 compared to 2020, there's an increase by more than tenfold. Okay, I'm not just saying, well, the young neurosurgeons did it, but at least there was a significant contribution of the young neurosurgeons. And when you look at the contribution of young neurosurgeons, if you compare the era where the Young Neurosurgeons Forum was created compared to the past period, then the past 25 years, young neurosurgeons published at least 60% of the articles. So which actually shows the power of young neurosurgeons. So if we have more young neurosurgeons who are trained in research capacity building, who are motivated to write and publish, who are motivated to conduct research, then this can actually change the story in most of the parts of the world, like in Southeast Asia, Latin America, and Sub-Saharan Africa. So you can see the impact of the Young African Neurosurgeons Forum. Here, there was a drop around the COVID-19, around when there was COVID-19. So that's why you see this drop here. But you can notice that after that, there has been an exponential growth in the research productivity from Africa. So this is a very concrete example of the impact and the power of young neurosurgeons. Of course, we urge the pioneers and the giants to get young neurosurgeons involved in major programs. You know, when the Bogart Declaration was made, I was fortunate to be working with KPAC, so he made me the research lead, and we're able to achieve most of the goals in the Global Action Plan. And we hope that with the Boston Declaration, they are going to engage much more young neurosurgeons to be involved, so that they are given the possibility to develop their creativity, their innovative spirit, and improve on the research output and decrease the disparities. So just to conclude, research is very important. You know, Kerry gave a diagram with a number of components. Okay, this is something which we've been talking about for the past years. We feel that for one to be able to practice neurosurgery adequately, especially in 2025, and for young neurosurgeons who intend to succeed in their careers, they don't need just to focus on patient care, that's just doing operations, operative neurosurgery. They need to be teachers, they need to be able to be involved in training and educating the future generation and actively involved in research. And most importantly, they need to advocate for global neurosurgery, because global neurosurgery does not only focus on patient care, it also helps in developing of the neurosurgical system. And without an appropriate and adequate neurosurgical system, you can't practice good neurosurgery, no matter how skilled you are. And for this to happen, the young neurosurgeons need to be trained in clinical epidemiology. They need to have basic knowledge on clinical statistics, and they need to understand the concept of evidence-based neurosurgery. By so doing, they are going to be able to offer optimal care to the patient and narrow the gap that is existing especially between high-income countries and low-income countries. Thank you so much.
Thank you, Dr. Esene, for this a very nice overview and very important last talk that kind of bonded all three talks together. A very important message of getting your work published, and the importance of research and trying to change our current reality, because that is something that does help, and you have demonstrated that with the young counts. So I think we have surpassed the hour. So I wanted to ask Professor Kato if she had any final words to end this webinar. Professor Kato?
Please unmute your mic, Sensei.
Okay. Sorry. Well, thank you very much for the three talks. And this is quite a new contents for especially the Asian doctors, I think. I think usually I have a 4 or 5 fellow from all over the world, especially Africa and also Asia. They are trying to write a case report towards to the original articles. I think besides that, they are trying to bypass training every day. I think those small things is very, very important for young doctors. They can learn during that time, maybe research and also education and fellowship, and also someone said the leadership. I think those things is very, very important for their futures. It's a time of the paradigm shift of the neurosurgical treatment, I think. So the more and more the less invasive treatment, and the young doctors must learn about those according to those philosophy, and also including the AI. We learned a lot from 3 speakers. Thank you so much. Maybe Oya Sensei, you can make some kind of a closing remark. Your talk was excellent.
Okay, thank you for having me here. Well, I have one comment to Dr. Esene and one question to Dr. Vaughan. I am ashamed that I didn't know the situation. I really didn't know the situation of young neurosurgeons in Africa. And I felt it's very promising that the number of the papers or the researches are increasing in your continent. And, I will, keep myself updated regarding your activities. Thank you. And Kerry, I think you have a wide experience in communicating with the young neurosurgeons in Africa and through the Barrow project. And you're maybe involved in some education or teaching, but at the same time, I think there must be some important things that you learn from young neurosurgeons in Africa. And if you have any experience or episodes that you learned from them, could you share with that?
Thank you, Professor Oya. Yes, it's definitely bi-directional learning. You've hit upon the critical point, I think, of this really worldwide work is it's a two-way street. And that's, I want to emphasize that we learn, in both directions and, and whoever's involved. So I would say some of the most important lessons that I've personally learned and taken away is the energy and dedication it takes to get through an already challenging path like neurosurgery in settings where there may be even more constraints, as Dr. Esene mentioned, for something like research, seeing residents take additional time away from their families after already a long day in the hospital to write case reports as a starting point. I think very common for all of us. And then want to develop research projects and quality improvement projects and seeing the struggles that their patients go through, but that still inspires them to find the time to work on individual, again, projects, whatever that might be. Learning to wade their way through predatory journals. I've definitely seen them, use their own salary to pay very expensive article processing fees, and looking at that and saying, no, there must be a better way, to help them do that. So, learning from that kind of process and the challenges that they face, and yet the resilience that they have, I think has been the major takeaway point for me. And there's technical points to that, creating or replicating instruments in the operating room, in the theaters, from what is available when things aren't working, to patient care, how to monitor patients safely when you may not have all the ICU resources. So it really is a story of resilience that I've learned from them and how to adapt.
Mm-hmm. Thank you. Thank you.
Thank you.
There is a comment in the Q&A. That's a very positive comment, thanking the speakers for the excellent presentations, and saying that young neurosurgeons need more practical mentorship and vistas for training and development, especially in low middle income countries. Yeah. I think it is, I agree, of course. I think all of us would agree. And I also think it's important to emphasize that it's, yes, Africa is the continent that is mostly affected. And we are, working to develop them. I think it's also important to emphasize that other regions, also Asian region, has been doing a lot of great work in global neurosurgery, not even knowing that it is global neurosurgery. For example, there was a talk on the government of Indonesia that was explaining on how they were improving capacity building in their country by training non-neurosurgeons to do neurosurgical procedures, and not themselves not even understanding that this was part of global neurosurgery, but making very important work without even knowing what they were actually doing in the global neurosurgery space. So I think it's also important to, that type of work also being published and seeing that there is an academic space for all of these initiatives. And that is a different type of research within the, the classical neurosurgery space, but it is an extremely important one. The public health for many countries are intricately involved within neurosurgery, and I think the combination is the actual power of the global neurosurgery. There was, I think,
There is
someone
a
raised.
raised hand. Yes,
Yes,
that's Ms. Sylvia Masavis. She's a nurse, I suppose.
but I don't know how
Okay.
to give her
Yes.
the
Please,
mic.
Okay.
Okay.
Sylvia,
Thank you.
go ahead.
Thank you. I'd like to thank you, the organizing, for such a educational webinar. For sure, there is really disparity in neurosurgery, especially in low and middle income countries. But nursing part have been the part which have been not foreseen for couples of the year, as we are striving to see that the nurses are the backbone of the patient care should be incorporated in the updates and research and educational wise. So I would like to think that how we can incorporate nurses in research, because they are the one who really manage those patients at the bedside. So that webinars are very, very crucial, but nurses should be the part to bridge the gap and disparities in LMIC. Thank you.
Absolutely. Very good comments. Not only nurses, but also other specialties like physical therapy, rehab, neurologists. I mean, we're all a part of this big team, and many countries lack these specialties as well. So yes, I think that is also part of global neurosurgery, to look at all the different specialties involved and get all of them a platform and a way to also conduct research. There are nurses getting PhDs, so it is possible. So yes, fully agree. Anyone else have an additional comment to make? No? Okay. Well, then I think we can conclude this first and very successful webinar. Thank you all for coming, and hopefully we'll have many more great ones. Thank you.
I would
to all
just
the
like to
speakers.
make one comment that this webinar
yes,
is
please.
recorded and is archived on the ACNS YouTube channel. Just go to the YouTube, type in ACNS webinars, click on the playlist and search for ACNS Global Webinars. You'll find this video. Thank you very much.
Thank you.
Thank you.
Okay. Fine. Bye-bye.
Thank you all.
Bye.
Bye.
Thank you. Bye-bye.
Bye. Thank you very much.